All right. Well, we're on our way.
Well, I got Elder Shirley call me. Hold on a minute.
Okay. I'm gonna have to try to manage all of this social media all at once. I hope I hope I don't cut anybody off. Hamid, are you going to be the our spokesperson today?
Yeah, for American Cancer Society. We
I
should have one
like
more
it.
joining too,
Oh,
actually.
fantastic.
Thank you.
Fantastic.
How are you?
I'm well, thank you. I'm well. I think I'm supposed to be sharing a document, but um, we'll see. I was waiting for Pastor Jenkins to come back. Uh, he left us for a moment. I thought he'd be back by now. Okay. Thank you very much, Pastor Jenkins.
You're welcome.
All right.
How's everyone doing today?
Good, good. How are you?
I'm doing
Good,
well.
thank you.
It's warming up a little.
Did Elder Shirley make it on?
I
Pastor Laura.
don't see
I,
her yet.
I just forward her the link.
Okay. Okay.
So we're gonna get started if that's okay with everyone.
I mean, what else we gonna do?
You can put up the PowerPoint.
Okay, I'm loading it now. Okay. Right. Sorry about that. I'm gonna show my screen.
I want to say good morning to everyone. Uh, we want to welcome you again to our community conversations. This particular topic has become extremely important and has been a learning tool. And we recognize we have persons that are joining us not just via Zoom, but also via Facebook. Uh, and the reality is that we are constantly trying to navigate to make sure we're able to get a solid platform that's going to make sure that we're getting widespread communication. So we're probably a month and a half into these community conversations. And so actually, we're very proud of the progress that we're making. And as these communications, these community communications go, you will see some upgrades in regards to how we're able to present what we're doing. So we just ask your patience with us as we navigate this particular aspect of our community conversations. Next slide, please. So for those that have probably heard parts of this and those that may be new to these particular conversations, one of the things that we as the Minister Alliance are intentional of doing is recognizing the importance of screening. And in that screening, we also recognize that survivorship is important as well. But the reality is we cannot do this by ourselves. And as a result, what we have done with an intentionality is to gain as many partners as possible to help us communicate the importance of screening and how this affects our Black and Brown community. And we're extremely proud of all the persons that have joined us as community partners, sharing their expertise on an informational platform, but also even our partners sharing regards how cancer has affected their families, affected them, and affected their communities. Next slide, please. For this particular initiative that the Ministers Alliance are leading, we recognize that there are 4 specific cancers that we're highlighting, but the reality is we recognize there are other cancers that are prevalent within our communities, but the 4 that we are focusing on are the ones you see on the screen: cervical, breast cancer, colorectal, and lung. And the reason why we focus on these, there is assistance for those that may be dealing with these particular cancers that can help them. We know that there are others that are other cancers that are out there, but these particular ones we're able to navigate much differently when it comes to screening. But what you will hear either be questions or from our partners is that they will highlight on cancers that may be affecting the person asking the question. These are the experts that can help in regards to navigating this. Next slide. Community conversations, we'll be doing this throughout this particular initiative. We won't be doing as many once we get into the cancer screening, but we think that the community conversation is something we need to be very adamant in regards to continuation. The three-legged stool that I speak of when we talk about cancer is community conversations, cancer screening, and survivorship. Those particular aspects will help our community understand, become more comfortable relative to how cancer affects them personally or affects their family or their loved ones, and become more agile in being able to share with others who are not engaged or understand that these community conversations are ongoing. So community conversation is important. Cancer screening is important, and survivorship is also important. And what we want to overemphasize is the importance of cancer screening. Early and often is important, depending on your particular family history, but just as important, the importance of screening. Just screening in itself must happen. We cannot put it off. Uh, and just so I reflect upon the last community conference, I have made my appointment for my screening. So I am on the right track. And the best of us have the tendency of putting these screenings off. And what we're finding when we put them off, there are instances when it's too late. So that becomes extremely important. Even the best of us try to stay on top, but even the best of us, like myself, knowing that it's time to have that particular notification to your doctor becomes extremely important. Next slide.
I will say I'm very proud of you, Pastor.
My wife is too, believe it or not. And to your point, Alicia, it becomes important that we have persons that will push us. And you know, whether it's a partner, whether it's a family member, whatever the case may be, because that heightens the awareness, not just for the individual that they're trying to encourage, but also themselves and others around them. We all care for persons that are part of our circle, so to speak, and want to make sure that we're able to make an impact on their lives and prevent things that may be caused by cancer. But with that said, we also have to recognize that cancer is not a death sentence. And that's why it's important to do many screenings, the early screenings, and share that importance of routine screenings are very important. And early detection, actually, with the sciences that are available now, the early detection can actually, there are curable pathways that are available to us. And so that becomes very important. Within the Black and Brown community, no one likes to talk about that C word because it's looked at as the worst case scenario. In its reality, it is not necessarily the worst case scenario if we're able to stay on top of what we need to be doing. Next slide. And so we recognize that within our DNA, there are certain things that are prevalent in our families, and the more we're able to have conversations with family members and to hear uh, some of the medical situation that they've gone through, that is also an alert for us as we're listening, an alert to make sure that we're also asking our primary care physicians in regards to some of the steps that need to be taken. Uh, when we know that there's a prevalent illness within our particular families, that is nothing to sit on, but it's something that we should make sure that we should make known. I share an example. My father has had dementia. He passed away in September, but I was talking to my primary care physician probably about 2 years ago, and I try to be kind of smart, my primary care physician, and so he was asking me some things about high blood pressure and all this kind of. I said, well, so I said something really smart, and it was really, I should have said. I said, I want to be like just like my daddy. And he said, well, don't your daddy have blood pressure? Don't your daddy have dementia? So you sure you want to be like your daddy? And so the reality is, we said it in a joking manner, but it makes you think. You might want to be like somebody, but you want to try to weave in those good things about somebody as well, and particularly when it comes to our medical. Track record in regards to family and what we see in our family and the diagnosis that may be a result of. And so that's why the family health history tool is very important. The link is here that comes from Rhode Island Department of Health. And I would advise those that are listening to make sure and seeing on your particular devices, whether you're on Facebook, please make sure you write down this particular link. This link allows you to have conversations with your family, but also gives you a pattern or a pathway in regards to specific questions that you can ask, and that becomes extremely important, extremely important. So take the time right now and write down this particular link because when you have family sharing, we learn, and so that helps us and helps you and helps your loved ones to understand some of the things that you're dealing with, or as a family you'll be dealing with. Next slide. Again, partners are extremely important. We are very happy with the partners and elated with the partners that are supporting us, and we're adding more and more as we continue these community conversations. But the bottom line is that we know that we cannot have these community conversations without the subject matter experts, and so we're able to lean on these particular organizations, these particular community leaders that help solidify the importance of these community conversations, the importance of screening, the importance of survivorship. And when we look at what we're trying to do, the goal is that we over communicate, but we're also educating our community. And these partners help us to emphasize that point. Next slide. And so when we have these subject matter experts, you're able to ask questions that is within their realm and able to get correct answers. We, as an Administrators Alliance, cannot give you the correct answers. We can emphasize the importance of screening. We can emphasize the importance of what we are trying to do to help our Black and Brown community. But when we have our partners, they are the trusted voices, just as we are trusted voices in the community. Our partners are trusted voices within their expertise. Next slide. And so our first person that will share with us today is going to be a survivor, Elder Shirley. What we learn when we get into uh, these community conversations, each person has a story to share. And what these stories do is actually it may bring a light to a lot of things that are going on and encourage others to ask questions relative to how what is their journey, what are the results of the journey, what are the lessons learned from their journey, and the impact that it's had not just on them but also our families. So at this time, we'll have Elder Shirley to share her story. Thank you, Elder Shirley. You're on mute.
I don't have my glasses on. Good morning, everyone. Thank you for this opportunity. I'd like to say on Saturday, March 16th, I will be breast cancer free for 21 years for the second time. And then in July 3rd, I'll be 45 years breast cancer free. So it's a double whammy. So back in 1979, I woke up one morning. Back then, we didn't have cell phones. So my house phone was ringing, and I reached for the phone. And when I did, I had a sharp pain in my arm. Kind of ignored it. But as the day progressed, I found I had a pain in my breast. So I called my gynecologist. He had me come in and, you know, examine. And he says, "Oh, come back in 2 weeks. You haven't had your monthly menstrual, so sometimes your breasts will swell up." So I did that. I waited the full 2 weeks. But in the meantime, during that wait, my left breast had actually tripled in size. I could not lift my arm. I was extremely sore. But the doctor said, wait. So I waited. I went back to him and he sent me to have a CAT scan. When I went to do the CAT scan, they refused to do it because they said I was too young. I was in my 20s at the time, had 2 young children. That was on a Friday. I called my doctor, very hysterical. He called the hospital and said, "You need to do this CAT scan." So long story short, that Saturday, they did the CAT scan. On Monday, um, I went back to see my physician. They said it was positive for cancer, breast cancer, but the type of cancer that it was a very fast growing cancer. And so they would have to remove my ovaries. They didn't do a biopsy or anything. They said, so when you're on the operating table, they do what's called a frozen section. They said, we'll send that down to the pathologist. If it comes back positive, we'll have to remove your ovaries immediately. And so that's what happened. They sent the frozen section, came back positive. They removed my ovaries. A couple of days later in the hospital, the doctor came back to me and he said, there's something strange. We received the frozen section. We're not detecting cancer. So we need to go in and do another biopsy. And they did. A couple of days later, came back negative for breast cancer. There was really no medical reason why there was no breast cancer. But being a woman of faith, I knew that it was the hand of God. So that time passed. Fast forward to October of 2002. And I wasn't doing breast exams in the 70s or in the 2000s. But that particular day, I was sitting on my sofa and I said, oh, let me do a quick exam. And so I began to examine my breast. Left breast was fine. But when I started examining the right breast, there was a black gooey substance coming out of the breast. So I got a handkerchief and I sat on my sofa for about an hour and I made a polka dot handkerchief. That's how much fluid was coming out. This was a Saturday and we were planning an event, so I didn't tell any of my family members. On that Monday, I called my primary care physician. She had me come in. She examined the breast. She sent me to see a surgeon who did a biopsy. And when they do a biopsy, they do up to a margin to where they think the cancer has stopped. A couple days later, she gets the results back, and there's cancer beyond that margin. So now she wants to do another biopsy. Same thing, biopsy to the margin, comes back, there's more cancer. So now she's baffled because she didn't expect that. So we did a third biopsy, same results. So she sent me to see a radiologist. She said that radiation would not be an option for me with the type of cancer that they were detecting. And the type of cancer, see if I can get the name correct, was in ductal in situ. That means the cancer was confined to the ducts of the breast. And they had also sent me for an ultrasound. And in this ultrasound, it looked like a black canal going through my breast, how this fluid was flowing. So the radiologist said, I suggest if you were my mother, I would have a mastectomy. So then I went to see a chemo doctor, and she said, absolutely not. Chemo was not an option for you. So I go back to my surgeon. So really my only option was to have a mastectomy. I flipped out. Surgery was scheduled for February. And I guess I had a mini breakdown. So my doctor sent me to see a psychologist who specializes in people in a medical crisis. And I talked with her for a couple of weeks, and she really did help me through it. So I decided, okay, I'm going to have this mastectomy. So on March 16th of 2003, I had a mastectomy. And at the same time, I had a breast implant put in. It's like I said, it's been 21 and 45 years. And it hasn't been an easy time. Not being a vain person, your breast is a part of your body. So losing a part of your body was almost like a death for me. I have my MAMs faithfully every year. And just to let you know, it's not always a lump that you're going to find. Early detection, early screening is key. If I had screening back in the 70s, might have been a different outcome. We don't know. And also, if I had been having an early screening prior to in 2002. So I'm definitely an advocate for women and men for that matter. Check in your breasts on a regular basis. Takes a couple of minutes in the shower. For my family in 1970s, my children were young. I lived in Rhode Island, but my mom lived in Maryland. So I really didn't have a support system here. And then in 2002, when I had it, my kids were grown, I had grandchildren, but they were afraid. Nobody wanted to talk about it. My son definitely didn't want to talk about it. My daughter, everybody just kind of backed away. So you do need that support system. You need to sit down and talk with your family. And as we saw in the slide, breast cancer, any cancer is not necessarily a death sentence if you have early screening and early detection. So I encourage everyone to get screening, detection, exam, sit down, talk to your family. I have granddaughters that are at the age I was when I had the cancer the first time, and I encourage them to get checked. I encourage my son, he's 52, but I taught, when you go, you need to have your doctor do a breast exam. So I hope something I've said will encourage you to talk with your family members and to also have early detection for yourselves. Thank you.
Thank you very much, Elder Shirley. We appreciate your sharing, and we want to applaud you also for being did I get this right, 2 times
Yes.
cancer survivor, and so that validates what was said earlier. This may sound morbid, but cancer is not a death sentence when we're able to connect with the right experts. Even those things we don't want to hear, even as family members, we don't want to face. But the reality is, we want to keep our loved ones with us as long as possible. And so that is sort of the uniqueness of this particular initiative that we are leading. With all of our partners, it becomes our goal to continue to make it known that there are resources out there for the questions that many may have, but just as important, there's encouragement with those persons and speakers and the subject matter experts. It's also encouragement as a major platform to say, you know what, we can get through this. It may seem difficult at the time, but because of the resources, the partners that are out here that have seen various situations, we can get through this, get through it in a successful manner, and also help your family to get through these difficult situations. These are type of conversations we don't want to have, but the reality is we'd rather have them early than when we have a fatality, when we have a loved one to pass away. So the earlier we have these conversations, the more comfortable the conversations may be, even though it may open up emotional wounds, or the case may be. But instead of thinking the worst of a situation, now we have the ability to get in front of it so that we're able to be successful and help our loved one to be successful and go through their respective journey with them. And that becomes important. We don't want our loved ones to be alone. Even though we don't want to hear some of the things that are going on with the physical body or the effects of what will happen, we don't want our loved ones to walk this journey alone. Uh, we want to have Alicia from one of our partners from United Healthcare to also share. And I inserted Alicia early because sometimes we need to recognize that there are agencies out there, there are healthcare agencies out there that can help in regards to what they can offer, the more we're able to understand the preventive methods and the path that can be provided through our healthcare programs, the better off that we can be. So, Alicia, if you can share relative to United Healthcare and its platform that can help those that are listening.
Hi, I apologize. I'm having camera issues today, but so I do community outreach for United Healthcare, and me and my coworker, what we do is go out in the community and provide all this wonderful information that we're taking in from these community partners as well. So this helps us when people come and ask us some of the questions that we didn't know before we met these subject matter experts, that now we have this information to pass on to the community. But we go to multiple events. Some are just on cancer awareness, but wide variety of things that we go to, food pantries, meal sites like Amos House. But at each of these events, we make sure that we have flyers that have all of this information about cancer, how they can do preventive screening, what United Healthcare covers regarding this preventive screening. So just to make them aware, some Medicaid patients may not know that everything is fully covered for them. And sometimes that obligation of thinking that you're going to have to pay for something out of pocket, mostly to someone that may be homeless or is having financial issues, giving them that reassurance to know these things are covered for you. And please don't put off going to see the doctor because you feel like you can't pay for it. But now I've also come across many resources from attending these meetings that even if they don't have health care, may you be an undocumented ignorant, sorry, an undocumented person coming to this country, that now I found there's other resources on here that can help them get that assistance as well. So this has been so beneficial for me and my coworker. And anytime we're in these calls, I always, try to push it that we're here for you. Any questions that you may come across, if you have a family member that's having an issue, and it might not just be related to, something to do with cancer, just overall your health care. And if you have questions or issues regarding that, we'd be more than happy to help you. You just reach out to Pastor and the Ministry Alliance, and they can put you in contact with us so that we can get you all that information.
Thank you very much, Alicia. We appreciate all that you do. One of our partners, Sarah, that's responsible in regards to partnerships to reduce cancer. I think that's very important. They're a new organization, but they are very impactful in regards to cancer screening and the aspects of knowing where you can go get screening. And I'd like to have Sarah to share because the more we know about to answer that first question, where can I go get screening? And this is specifically what this particular organization's uh, focus has been to lead the community, to add an additional resource to go to, so that they can address what we're all talking about, how we can reduce cancer within the state of Rhode Island. So, Sarah, if you can share.
Yeah, so hello everyone. My name is Sarah Gingrich. I'm the coalition coordinator for the Partnership to Reduce Cancer in Rhode Island. And just a little bit about us, and our mission is we're just a group of people that are working to reduce the burdens of cancer in Rhode Island through education, advocacy, and support. And we have been an organization for a while. It became a nonprofit a couple of years ago. But our main goal is to just help people, educate people. Some of the things we do are lung cancer. We have a lung cancer screening task force. We have an oral health care task force, a prevention screening and early detection task force. And if these are some topics that are of interest for you and you want to get more involved, you can always let me know and we can add you to those meetings. We do have quarterly membership meetings. Our next one is the last Wednesday in April, I think April 24th at Bethel AME. We're going to be talking more about HPV screening at that one. The topics change each time. So again, if you're interested about that event is on our community event calendar on our website, as well as some other events. We have some that are not even sponsored by us, the Ministers Alliance, all their community conversations are on there, other support groups as well. So if you're just looking for other ways to get involved and have a support group for you or for others in your life, you can find all of those on our website as well. We're working on updating our support list. So, and hopefully in the next couple months, it will be very accurate. There is also on our website more information on lung cancer screening and other programs for survivorship and treatment. Some other events of ours that are coming up in October. On October 16th, we have our annual cancer summit. More information about that will be sent out later once we have that information. So again, if you're just looking to be more involved and help the community, and this is something you're passionate about, you can reach out to us and we can see what ways you can get involved. We always love having people there that are just willing to volunteer, whether for tabling events and just share information with their communities.
Thank you very much, Sarah. We appreciate all that you do within the community, and it becomes important that sometimes I like the name of the organization because it really addresses what they're trying to do, reduce cancer, and so that gravitates people to even ask more questions relative to how that may be impacting them and their lives. And we also have the branch organization from the American Cancer Society, Hamid, and and this is being introduced to this particular organization was very impactful for me because you have persons, young adults that understand the significance and the importance of cancer and how it has impacted them. And sometimes we think that cancer only affects those that are middle age or seasoned, and that is not necessarily the case. And what we find is that many of these young adults may have experience, but also the experience of how it impacted their families. And sometimes we need to hear those stories as well. So, Hamed, if you could share at this time.
Yes, thank you, Pastor. And the Alliance, I'm also joined by Angela, who I'll pass the mic to in a few minutes. But for those who don't know, the American Cancer Society is a leading cancer fighting organization with a vision to end cancer as we know it for everyone. We improve the lives of people with cancer and their families through advocacy, research, fundraising, and patient support. We do this in a few ways. So we support access to care for everyone. This includes high quality, affordable healthcare and closing the Medicaid coverage gap, including for those in Rhode Island, through our Cancer Society Cancer Action Network. We advocate for prevention and screening, healthy lifestyle and environments, regular screening like we've discussed today, and then also providing a trusted source of screening recommendations for healthcare professionals. And I will also drop a flyer in the chat after which has our updated screening guidelines for everyone in case you'd like to take a look. And then lastly, we do provide direct patient support for those patients affected by cancer, including a home away from home at our Hope Lodge communities if you need treatment for cancer and they need to travel, and then free access to cancer information via our 24/7 call helpline, which can be found on our website as well, cancer.org. And then our chapter at Brown, which has students like Angela and me, supports various pillars, including community events. And I'll talk about one at the end that's coming up that we'd love to have you join if you're interested. We volunteer at local hospitals, including Rhode Island and Hasbro, and at events like this. So I'll pass it to Angela, updates on our screening.
Thank you. I thought I would just talk a little bit about how important screenings are and give you guys some numbers and maybe draw from my own experience as well. So we talked a lot about how cancer is not a death sentence, and that's very true and very vital to know. I think equally vital to know is how common cancer actually is in the world. 1 in 2 men and 1 in 3 women will be diagnosed with cancer in their lifetime. So as such, screenings are important and incredibly important and a concern for everyone. And that's actually, in my belief, that's a really good thing because conversations like these spread awareness and bring other people into the loop in terms of a condition that is going to either impact us or our families or someone we know in our lifetime. So screenings, what exactly are them? Screenings are common. They're very well researched. They're backed by a lot of research, and they're life-saving if done routinely, and especially if you don't have any symptoms. A lot of people think that if they don't observe anything abnormal or any pain, that they aren't eligible for screening. In reality, screenings tend to target that kind of population because one of the most important functions of screening, especially for breast, cervical, colorectal, and lung cancer, is that it can detect precancers or growths before they turn malignant or before they turn into cancers in the early stages, before you start experiencing any symptoms. And this is especially important for cancers that don't show up until it might be too late. And I can, really substantiate this as the caregiver of someone who survived a very, very rare form of perinasal cancer that is local to where I'm from and where I grew up. And this type of perinasal cancer usually surfaces as headaches in the early stages. And that's something that can be easily written off, like I have a migraine or whatnot. And particularly for cervical cancer and other reproductive cancers as well, an important thing is that they show up as stomach aches, or they show up as very normal routine symptoms that doesn't necessarily scream cancer. It could just be, oh, I ate like a abnormal meal, or like I tired myself out. So in this case, screenings play a very important function in ruling out or even just locating a cause that could be more serious than just exhaustion or very routine headaches. Yeah, so I think an important point to remember is that screenings give a life-changing head start for you, your loved one, someone you know, to begin treatment if they have cancer before it has the chance to spread. And we have seen with research that is conducted at hospitals and also screening centers that with the proliferation of cervical and colorectal cancer screening accessibility, 2 of which we have focused on today, We've seen new cases decline in the last 30 years by about 55 and 45%, respectively. And in tandem with that is obviously the mortality rate have also decreased, primarily due to routine screening, the proliferation of vaccines, particularly for cervical cancer. Yeah, I think we typically associate cancer with like chemotherapy, with radiation, with very invasive and often debilitating treatments, but it doesn't have to be that way. Screenings are sort of this non-invasive preemptive measure that you can take to avoid the treatment that comes with a late stage prognosis. Yeah, I think that's all I had to say.
Thank you, Angela. And then I dropped our update, the American Cancer Society's updated screening guideline for the Black community in the chat. It's a very helpful PDF that has lots of information that Angela touched on a little bit. And then a last event we'd like to share is hosted by our Brown chapter in April. So we are hosting our first ever Relay for Life, which is a celebratory event full of fun activities and food in recognition of all those affected by cancer, including survivors like Elder Shirley and caregivers, family members, and everyone is welcome. This will be Friday, April 5th, 3 to 7 p.m. on the main green at Brown. And yeah, we'd love to have you join us if you're available, and thank you for your attention.
Thank you, Ahmed, and thank you, Angela, for sharing. And please take notice of the data. I think the data is very important, how it affects the Black community. And also, as Angela made the referral, is that mortality is decreasing. And so that is good news, because it's saying that communication is getting out to our communities. And when you're able to solidify not only say that cancer is not a death sentence, but you see the numbers, that becomes extremely important. And that's one of the things that we are going to be driving at with intentionality as we open up the aperture relative to documenting and gathering data. It becomes important. The reason for this initiative that the Ministers Alliance is doing is to also capture data. So as we move forward, you'll be seeing questions that we can actually begin to track. It becomes important that we're able to identify the success of this particular initiative. It's not just having the conversations, but it's also to make sure that we have data that identifies how many persons are actually part of these communications, how is cancer affecting particular persons, how is the success rate of survivorship, and how is the participation in general in regards to our communities having access, understand the resource that are available, and also understand the signs, as Angela has identified. The more we can encourage and educate ourselves and our communities, the more success this particular initiative is going to be. As much as we know that we're doing the right thing, it also becomes important that we have data to back it up. And so as you begin to see more data in a couple more sheets that captures that in a couple of weeks, please be an encourager to have others to fill it out. Because we need to understand exactly what our population is seeing, what they are engaged in, and what their awareness level is. And that becomes extremely important. And you'll be hearing more and more in regards to our data gathering. Uh, we want to make sure our next slide is going to identify our next community conversation before we get into questions. Pastor Laura, if you can show the next slide. The next community conversation is going to be in person. That becomes very critical in regards to understanding where we are and what we're trying to do. It's going to be at God's House, 45 Benedict Street, and the pastor is Bishop Dove. That's going to be March 14th, 6:30 to 8. We're really trying to gain more visibility with in-person sessions. We find that the in-person sessions also allows for more personable questions as well as what we're able to do on Zoom. And the next two sessions will be on Zoom, and those dates are March 19th and March 21st. As we grow in how we can better, i.e., no pun intended, communicate these community conversations, you will see things far more in advance, identifying what particular subject matter expert, doctor, or what particular cancer will be the focus point. And so we ask that you continue to bear with us as we begin to do a better way of communicating what is upcoming. And so that also may pull in additional people that may have concerns and have questions as well. What we want to do right now is open up for questions. If there are those that have questions, please do so at this time. So Angela, the question I have for you, particularly the data that you shared regarding our Black community, um, how difficult was it to gather that data? And the only reason I'm asking that because I recognize that many from our community are very hesitant in regards to sharing and giving information. Can you give any insight in regards to that?
Thank you for your question. Yeah, I think a lot of the data that ACS uses in communication are like systemically gathered. They're usually part of a funded research endeavor. And I don't say that to like sound exclusionary because it isn't. Gathering data can be like a very accessible, very easy thing. It doesn't have to necessarily take the form of oh, like we're like systematizing this like survey, like, you know, proliferating it. Like it doesn't have to be like super specialized at all. I think a lot of it comes from, you know, just being at places where there's a lot of traffic and handing out surveys or stopping passersby for like a 1 to 2 minute time or window to fill it out, or even just after the event, after each community conversation, handing out a survey and having people fill it out and give it back by the door. I think something important that could help people open up more about their experience is keeping the surveys anonymous and making sure that they're paper surveys as opposed to digital surveys when there's like a footprint. Like little things like that can go a long way to assure people that their information is being used towards the betterment of knowledge instead of something more questionable even. And you know, at Brown, there is a very robust survey effort on not even only on part of ACS, but on part of newspapers and also journal publications, and they are definitely they're a very simple process. I think making it as simple as possible, in fact, even helps the process of getting as much information as possible. Yeah.
Thank you very much. I have partnered with Brown on several occasions in regards to data gathering, and Brown does an excellent job relative to that. And one of the things that I've learned is that we as faith leaders are trying to be intentional in reaching out to our communities, because the more that we have that identifies what our particular data-driven information is, it's going to help our community. And so that has become a message for all of us in regards to not just this particular effort, but many others. And I want to thank Brown for the expertise they bring to the table regarding data. That becomes extremely important and helpful, specifically within our Black community. So really want to thank you all for doing that. Hamad has given us also some information that we need to be aware of. So we want to make sure that we recognize how we can do a better job in helping the situation in regards to screening uh, and also the Relay for Life. We want to make sure that we highlight this is April 5th. We want to pass this on to many as possible within our community. These young adults are doing an excellent job in regards to spreading the word. And so we want to be very supportive so that they can have a successful event. They have not missed one of our events that we have had, and we greatly appreciate it. And as young adults advocating for the American Cancer Society, I say they're doing an admirable job in regards to getting the word out there. And so I encourage everyone to make sure that you're able to get on their respective website. There may be persons that are on either Facebook or through our particular YouTube that may have questions. Are there any questions out there that you all may have? So Pastor Lori is manning that particular piece. You see anything out there, Pastor Lori?
No, not yet.
Okay.
But
Is there anything?
I did have a question.
Okay.
Sister Shirley was sharing her experience. She talked about screening and how initially the first screen came back negative. Is there any recommendation that anyone could provide to those who are listening what to do in those situations? She was very determined that this was not normal for her. But is there anything that any of our subject matter experts can provide for people who may not have all of the knowledge that Pastor Shirley has?
I would say, you know your body. So if something doesn't feel right and you're not getting the answer you need, then you need to go get a second opinion or ask for additional screening. Don't be afraid to, go seek it from another doctor. Because like I said, you know your body. So you know when something's not right with you. And if they're telling you, oh no, you're okay, then you need to go to somebody else and make sure that that's actually accurate.
Hey, I would add one thing, and I usually don't speak up during these conversations, but I just wanted to let folks know. Elder Shirley, I know when you initially went through this, it was a number of years ago. One thing I wanted to just point out is that the technology is greatly improved since then. And so therefore the instruments that are used to screen people, for example, mammography is now 3D in most cases. And there are other tests that can be done that will determine the nature of any sort of irregularities that might show up on the first test. It's just important to know that the technology has improved. And so therefore it's not unlikely that you might get an ambiguous result, but there are other tests that can be done to clarify what that result might mean. And that your insurance will cover that for breast and cervical cancer in particular. Thanks.
I would just like to also add, back in the 70s, like you said, we didn't know a whole lot, but this initiative is so important so that we can be educated. I was totally ignorant back in the 70s to the whole process. So again, getting this word out is extremely important, especially to the Black and Brown community, because in our community, there's a fear of getting exams. There's a fear that their insurance won't cover it. And finding a surgeon who is adamant, like my surgeon, she had no bedside manner, but love her to death. She doesn't do office work anymore. She's actually a professor at Brown University. So yeah, getting the word out. This right here is so very needed, and advocating for yourself and for your family.
Thank you, Elder Cheryl. That also highlights what Hamed identified in regards to interactive cancer screening guide. The more we're able to read and see that particular data for our community, our Black community, so we really got to feed that type of information to our community so that they can see and read it for themselves. We'll able to put data in people's hands and put in information that can help, that solidifies the goal and what we're trying to do as far as educating and encouraging a steeper and in-depth awareness of cancer and the preventive measures as well as everything else that we're talking about. If we do not have any other questions, we want to say thank you to everyone that has joined us. Again, if we can pop up the next community conversation, I think the address is God's House on 75 Benedict Avenue. Just so everyone's aware of that. And in addition to that, that the following two will be via of Zoom. 45 Benedict Street in Providence, I'm sorry. So please, those that can come out to that particular event, please get the word out. And also for the following community conversations that will be via Zoom. I want to thank everyone. I think we're close to the noonday time. We appreciate everyone coming. We appreciate your attendance. We thank all of our partners for their continued support. And we know that this message is getting out, and we will see the fruits of your labor. And as Angela has identified, the goal is to reduce the mortality rate. So again, thank you, everyone, and thank you for your support and encouragement.
Thank
Bye-bye.
you.
Thank you, everyone.
Thank you.